All right, Health Check 10 now. A first-of-its-kind surgery performed in Rhode Island. It could have an international impact. Here's Barbara Moore-Silva. Barbara?
It was done on the spine and is so trailblazing, it appears in the current issue of an international medical journal. It involved the patient, a teenager from Fall River, to be awake throughout.
How are you doing? Oh my gosh.
It's been a while since Janelle Camara, her friends call her Nellie, has seen Dr. Albert Telfeian. He's actually more than a surgeon to her and her family. He's a hero. To understand why, we need to go back a few years.
I'm a cheerleader and I play softball and stuff, so I've always had like really bad back pain.
Which meant lots of doctor visits.
They just took x-rays for years and just kept telling me it was inflammation.
But then on New Year's Day of last year, when Nellie woke up,
I wasn't feeling my hands, my legs were all numb, my stomach was numb.
She couldn't walk, and that landed her here, Hasbro Children's Hospital in Providence.
So last year she came in with the worst case scenario where she was a 15-year-old girl with a spinal cord tumor in front of her spinal cord. So you have her heart, and then you have a tumor in her spinal canal pushing her spinal cord up. It was a miracle surgery because I was able to get 100% of it. The problem is that we sent the pathology to the best cancer centers in the United States, and no one could figure out what it was.
Nellie had radiation therapy and was deemed cancer-free, but then it came back with a vengeance.
He promised my family, I'm going to do the surgery and I'm going to get something out of it and I'm going to get your daughter a diagnosis after a year, I promise you.
This time he did her spine surgery endoscopically through a pencil-sized incision with only local anesthesia and a little bit of sedation. But for the most part, Nellie was awake. So you went in for this really innovative surgery.
Mm-hmm.
You were awake.
Mm-hmm.
What did that feel like?
I don't remember me being awake.
But she was, and talking away, says Dr. Telfeian. He repeatedly asked her to move her legs.
As long as she was moving her legs, I was happy.
There was a reason why.
To make sure that, because this is pushing her spinal cord, she could be paralyzed. This is a nightmare for a surgeon.
A week later, as he promised the family a diagnosis, Ewing sarcoma, a rare but treatable bone cancer. This is all that's left from that second surgery, and she's currently undergoing chemotherapy. The even better news?
Your MRI looks amazing.
And now Nellie, who's 17, is looking forward to going back to cheerleading in the fall.
The doctors told me I could go back for my senior year.
Yeah, and she's considered, I think most of her tumor is gone now. And now Dr. Telfeian's work is chronicled in the Journal of Clinical Neurology and Neurosurgery. He's hoping his work will catch on and inspire other spine surgeons to do this. For more on Dr. Telfeian's surgery and for more on Nellie, she has a special Facebook page set up. All you have to do is log on to turn10.com and click on health.